Hi, my name is Christopher Rusch, Regional Director of Operations at Intercoast Colleges. Today I'm at the West Covina campus with Evangelia Kafkalis, who is a former alcohol and drug counseling graduate of ours, who has a decade of service in the alcohol and drug counseling community, valedictorian, and our new clinical coordinator, who's today I get an opportunity to connect with and ask some great questions too. So Evangelia, tell us a little bit about yourself and how you got into the alcohol and drug counseling community.
Well, first off, thank you for that introduction, Chris. And secondly, I'm honored to be here to have this opportunity to speak with you. And the way that I got into this field was I've always been fascinated by human behavior and addiction in particular. And so I graduated from Cal State Fullerton with my bachelor's, and I needed some experience in this field. So I reached out to an outpatient clinic, asked to do some volunteer work, and not having any experience, they did take a risk on me and they let me do volunteer work for about a year, and I fell in love with the field. I loved going to work. There wasn't a time that I just didn't want to go. And at the time, a friend recommended Intercoast College and said, why don't you pursue your education there? I've heard amazing things about it. And so I did, and graduated from Intercoast, had an incredible experience. And I've dedicated the last 10 years of my life working with clients.
Wow, that's impressive.
Thank you.
So what inspired you to become an educator in addiction studies?
I think for me, two things. One, I've always wanted to teach. I think ever since I was in 5th grade. And that was something I really wanted to pursue, but I wanted to study human behavior first. That kind of, for me I was more fascinated with that. And then being in Intercoast, seeing how incredible the instructors were, particularly Miss Judy, she's amazing. And, being a part of that environment really motivated me. And I told myself one day I want to do the same. I want to help students. I want to be there. I want to be able to change their life the way that they changed mine. And so I reached out to Miss Judy after 10 years. I knew that I had enough experience and asked her for this opportunity, and I'm so honored to be here.
We're honored to have you. And so as the new clinical coordinator, tell us a little bit about what that really means, what that role is going to entail.
So my role is to really help guide, support students and in their internship, who are starting their internship or are in their internship, and also to reach out to, do community outreach, do developing sites and relationships with sites that our students are going to be doing their internship at, also doing continuing education and test prep workshops.
Okay, that's a lot of support. Wonderful. So what do you believe are some of the biggest challenges right now going on in the alcohol and drug counseling community?
Shortage, I think, is a huge challenge that we're facing, and I'm hopeful that more, students, more individuals will be a part of this workforce and join this incredible field and work in different settings. There's so many opportunities in this field and education, and so I hope that that's something that can be changed.
How do you see the field evolving with alcohol and drug counseling now and in the near future?
I see it growing. I see more people wanting to be a part of this workforce and really, expanding their, work environments, not just working in outpatient clinics and hospitals and inpatient, maybe working in places that they never thought that they would want to work in, such as institutions, and really just this field really growing.
The support is needed everywhere.
Yeah.
So what advice would you have for individuals that are thinking about getting into the alcohol and drug counseling field, new, maybe nervous about it? What would you say to them?
I would say do it. It's been an incredible journey for me. I've been so incredibly honored and blessed to work with amazing clients and clinicians and supervisors, and I've learned so much. And I honestly don't regret working in this field. I've learned a lot, and I've had the opportunity to really change and help a lot of clients in their lives and their families. So I say do it. I highly recommend it.
Any success stories? It's a decade of service you've had personally in the alcohol and drug counseling field. Any success stories that really have impacted you?
A couple I can think off the top of my head that really were very valuable to me, that resonated with me. We had one client, he was on probation and he was very resistant to treatment and made that very well known. And we we assisted him with enrolling in Department of Rehabilitation for machinist school. He graduated with honors, was able to get his own apartment, was medication compliant. He was involved in therapy and, alcohol and drug counseling. And even after probation ended and he was no longer mandated to do counseling, he continued in his mental health treatment and was a huge success. And for me, another example would be when I was at the women's prison, the group was they were very hard to connect with. They weren't trusting of new facilitators. And so that was a challenge for me. And then they were able to see, that I really wanted to help and that, what the purpose of the group was. And the group connected and they all graduated the program and really learned a lot. And so that was incredible.
Wow, those are great stories. What qualities or skills would a person need to have to be successful in the alcohol and drug counseling field?
I would say listen. Listen to your clients, listen to your fellow colleagues, your supervisors, your instructors. Listen, ask questions. Don't be afraid to ask because the answer might be yes. And I know a lot of people fear asking and fear of rejection, but you just never know. And also be humble, ask questions so that you can learn because ultimately it's going to help you become a better counselor. It's going to help your clients and their success as well, the more resources that you accumulate over the years.
I agree. So what do you hope to achieve in your new role as clinical coordinator at Intercoast Colleges?
For me, the success that I hope to achieve is measured really by the success of the students and building relationships with different sites and our students being able to do their internships there and being, supportive of Intercoast as a whole. It's an incredible institution and so their education is, outstanding. And I know because I was a student here. So I just think that, for me, having that, ability, that chance to work with students and their success, I think means a lot to me.
I want to thank you for your time today. Those were really great answers we got from you today. And I think the students, Intercoast, and the community is really lucky to have you be a part of it. Thank you for your time today.
Thank you so much, Chris, and thank you everyone for watching.